I've been using BioZorb for a year and a half, and initially when I found out about the product, I thought it was a great idea and met some resistance from my radiation oncology colleagues who felt that it wasn't necessary. I was told that they didn't need this device because they could accurately assess where the lumpectomy had been and they could target the lumpectomy cavity. So I asked them to humor me, and we implanted a BioZorb, and the day of the planning, the radiation oncologist texted me because he was able to target the lumpectomy cavity much better. He was able to reduce his boost volume by 70%, and that would translate to a much better cosmetic outcome in addition to not compromising the oncologic outcome. So that was sort of the pivotal event in our use of BioZorb, and now I use it routinely for breast conservation patients who are having oncoplastic procedures done at the same time. I think when I first saw the BioZorb device, it intuitively made sense. It was a visible, physical thing. I mean, you can hold it, you can see it, and you can understand that if you are implanting that into the site where the tumor used to be, that would be the most accurate representation of where the cancer was, so that on the back end, the radiation oncologist would be able to verify accurately where the tumor used to be. Many times these patients have chemotherapy, and that can last for between 4 and 6 months after the surgery. So by the time the patient actually gets to the radiation oncologist, the lumpectomy cavity may be altered through the healing process and may be harder to determine where the tumor used to be. So I think really it was a tactile, visual, intuitive benefit for patients. And the fact that there are titanium clips within the BioZorb itself that will remain afterwards so that the radiologist will be able to see where the tumor used to be is an added benefit as well.